I hear about traineeships. What are those about?
I mentioned that the ASHP Foundation has tried to direct its educational program activities in areas where ASHP is not already committed. And so back in the late 80s, the concept of a traineeship program was developed by the foundation, and it's a combined self-study experiential program in key areas of practice. And the first traineeship program was in anticoagulation drug therapy management. And that program has been offered for more than 20 years. There's more than 500 individuals who've been through that program. And they're so committed that they meet annually every Saturday prior to the beginning of the mid-year clinical meeting. So these are individuals who've advanced their knowledge through self-study and then gone to a site with an established clinical pharmacist experienced in anticoagulation, antithrombotic pharmacotherapy. And we offer traineeship programs in a number of areas like critical care, oncology, and pain management. And these are good options for pharmacists who've not had the opportunity to do a PGY2 residency program in an area like oncology or critical care.
Let's have a candid discussion about where the foundation's funding comes from, because the old adage, no money, no mission.
Yeah, that is a challenge for the ASHP Foundation and for any foundation associated with a professional organization or even a very worthy social cause. We need the support of individuals who have a passion for our vision and mission. We need individuals who can recognize and see the value of our work and be willing to support us. So we are fortunate that as our program capacity has increased and expanded, that our work is becoming more visible. And so we are seeing more and more pharmacists support the work of the foundation, but clearly there is a need for us to convey to practicing pharmacists the need for support of the foundation's work in order for us to do more to help drive advancement in the profession.
And because of the tax status, if I contribute, I can take that as a contribution off of my taxes, correct?
Indeed. The foundation exists solely for the purposes of advancing research and for scientific and educational purposes. So we do not represent any pharmacists per se, and because of that, our status with the Internal Revenue Service enables anybody who supports our work to have a tax-deductible contribution.
So as the executive, who's your boss?
Well, I work for a group of people, and indeed my boss is the board of directors of the ASHP Foundation. And this is a 12-member group. There is a chair, so technically my boss is the chair of the ASHP Foundation Board of Directors. And their responsibility is to oversee the organization from a strategic planning standpoint and from a financial and legal standpoint. And they hire me to execute on the strategic plan, to hire a great team of 8 individuals to do the work of the foundation. So it's a real collaborative approach. The board is enthusiastic. They want to see us grow the work of the organization, and they help us in communicating with the corporate world in terms of promoting the value of our work and with pharmacists as a whole. So it's a collaborative approach, and I'm really pleased to work with such a great group of motivated leaders on the board of directors.
Are all of those members of the board pharmacists?
No, indeed they're not. Some are, and these are pharmacist leaders who still lead in practice or who may be successful business leaders in the pharmaceutical and related healthcare industry, and some are not pharmacists. And the mix of perspectives, the varied passions that come to the table with the board members is really the key towards having a group that can help us advance the work of the foundation.
I would like to switch gears now, and with regard to career planning. When you finished your residency, was your current position on your radar screen?
Probably not at that time. What I can say is that I was committed towards being a leader in hospital and health system pharmacy. And so I was really, really fortunate coming out of my residency program at the age of almost 25 years old to become an assistant director at a tertiary care children's hospital in Washington, D.C. So I served in that capacity for 4 years and became director. So I knew that I wanted to lead in an environment like that. And I had the opportunity to stay in one organization for 17 years. And then when I made a move elsewhere, I looked to go to other aspects of, or other organizations in hospital and health system pharmacy. So my involvement in professional organizations was key as well. I was committed towards helping to drive practice through organizational work. And I think the combination of being an involved ASHP member and also being in the pediatric pharmacy advocacy group helped position me to be considered as a candidate and ultimately to become the executive for the ASHP Foundation.
What career advice do you give young people these days?
Follow your passion and be committed to your profession and be a leader. Your patients need you to be a leader, and the profession needs you to embrace the profession fully and to help drive advancement in pharmacy practice.
So if you're faced with the decision like you were to go to the foundation, you really didn't have background in that. Is that something you should worry about? You don't understand what the position totally is?
Oh, I don't think so. I think that the key is to understand yourself, know that if you want to succeed, that you can devote the energy and the work to going to a new level. And when you're given an opportunity like that, in this case for me, to work with other leaders in health system pharmacy practice, the key is to marshal your personal resources and talents and to work with others to really catapult the profession in this case.
What's the best mentoring advice you've ever gotten?
I'm not sure that I could identify one moment where one of my mentors said, Steve, you should do this. But what I would say is that from the 3 or 4 key people who served as mentors in my career, it would be invest in people. Invest in the people that you work with from a professional standpoint and from a personal standpoint. So know what it is that the people who you're working with want to do in their career and support them. Support them in their development, in their role in the pharmacy organization that you're working in. Understand what they value personally. Make sure that they have balance in their life, and be willing to say to them that I don't expect you to work with me forever, that your professional and personal development is key, and that I'm here to help you be successful professionally. Hopefully, working together for some time, but ultimately wherever you want to go.
And I know you mentor a number of people. What makes a good mentoring relationship?
I think, relying on what I just said, it's an investment in a relationship, and it's a commitment to excellence. It's a commitment to excellence in our profession, understanding what our talents and skills are, building on them, encouraging, motivating, talking, laughing. It's about enjoying what you do and overcoming challenges that come your way. So, I think it's really all about understanding how to be successful and helping one another in, I'd say, seeking excellence, maybe more so than being successful, because being excellent in what you do leads to success.
So how does somebody find a good mentor?
Well, in some cases, you might say it would be happenstance, but not really. It's modeling. It's about being associated with a professional who if you're a student, you might be doing a rotation with them. If you go into a residency program, it might be the residency program preceptor, or it could be an individual practitioner who's precepting a particular rotation that you're in. Or, in my case, in my first job that I went to, the individual who took a chance on me as a young practitioner and who helped develop me in my role as an assistant director. So there's many, many ways in which you can find a mentor, and it really is ultimately about making a connection professionally and a connection personally.
So that personal chemistry is kind of important, right?
Indeed. I think that for many of us, relationships develop in a variety of ways. And so I have mentors from people I have mentors that would consist of people whom I've worked for. I have mentors who are colleagues and who've given me a unique insight and perspective into practice and how I look at the world. So I would say that it's a very personal decision, but it's all about connection, and it's all about being focused on giving your best and being a good pharmacist and a good role model.
Life always seems to provide us with some challenges, such as when you lost your director job. Talk a little bit about how people can handle, both intellectually and emotionally, losing your job.
Yeah. I'm a believer, I'm a man of faith, and I believe that everything happens for a reason. And when you face a challenge, my organization was going through difficult financial times, and I was involved in leading re-engineering teams, working with consultants, and we knew that there was going to be a downsizing in the management structure. So when I got the news that it was delivered that we're going to do away with the director of pharmacy position, I realized that this was not personal. This was about an organization working its way through a difficult period. And I would say that my faith and my confidence in my abilities as a practitioner and my abilities as a dedicated worker and passionate individual pharmacist was what I was going to rely on. And indeed I did. And I just moved along and found another great opportunity.
So does having a professional network come in handy at a time like that?
Absolutely. When I left in those circumstances, the whole physician community came around. Pharmacist friends and colleagues. I had so many opportunities. So yes, indeed, a network of colleagues and professionals is key. It's key to helping you when you're in a position, and if you find yourself out of a position and looking for another one, it's just as important.
So landing on your feet is really key.
Yeah, get a bloody nose and you get up and you move on. It's resilience that we need to demonstrate, and we need to be confident and comfortable and perhaps maybe a term that I think you would agree with, we can't whine. We've got to get on and continue on our journey of excellence.
So as you think back over your career, what's brought you the most satisfaction?
Perhaps the most satisfying thing for me in my career is working together in an organization and seeing the fruits of our labor, and seeing, for example, the pharmacy department evolve. And for me, in most of the positions that I've been in, I've been fortunate to have a residency program. And I think I'm energized, I know I'm energized by working with young people and helping to develop them and having them challenge me and motivate me. And I think that's the piece that I miss most about being in the kind of position that I'm in now. So when students and residents come to ASHP and the foundation, I really chomp at the bit to interact with them and engage with them.
What's the one thing you wish you had done differently along the way?
You know, as I reflect on my career, I would say that there really isn't any one thing that I would want to change. We all make mistakes. We all handle situations that you can look back and say, boy, you know, I probably could have done that a little better. But I think the key is to learn from your experiences. And so when I look at my career, I can't say that there was anything that I regret. I think that it was important to me, and I think it's important to anyone else to build on your experiences and to learn from them and grow.
What impact do you hope your career is having?
Well, at this point in my career, I hope the impact is large from the standpoint of the foundation's work. Not anything that I do personally, but as we talked about, working with a board of directors, working with a talented staff, to provide more opportunities for pharmacists to showcase their skills and abilities and talents, to work collaboratively with other health professions, to advance the role of the pharmacist in the team, because we know we don't own the medication use process. So I think my hope for the future rests in a lot of the program efforts and the results from the programs that we've talked about that come through the foundation.
So I think you've sort of answered this, but what's your hope for the foundation of the future?
Yeah, well, I would hope that more and more people who are practicing health system pharmacists will see the value of our work and will support that. And I'm beginning to see some of those signs, and I hope that will continue. I hope that our work with other foundations and other corporations will be seen as a model for effectiveness, and that will garner the support of corporate leaders and foundations and businesses that see the value in our work. So I think it would be building on the record of accomplishment and being able to do more to help patients through the leadership of pharmacists working in teams.
So if you put your practice hat back on, what do you think is going to change in the next 5 to 10 years that practitioners need to be aware of and be planning and doing now?
Well, I'm one of those people who believe it's a critical time for our profession, and that we have to be bold. We have to demonstrate that our role in direct patient care is vital. And so I believe that the Pharmacy Practice Model Initiative, the leadership development programming that we're so committed to, is vital towards helping pharmacists step forward, lead on the organizational, institutional level, collaborate with physicians, collaborate with health system executives, nurses, other healthcare practitioners in that team approach, because we know that the healthcare system needs greater efficiency. We know that we need to lower costs, and there's just so many opportunities to reduce the kinds of complications that can come about from less than effective, less than optimal use of medications by patients.
Why don't you talk a little bit about what the ppmI is, what it entails? How did it come about? Where we are currently with it?
So ppmI, Pharmacy Practice Model Initiative, was an initiative that really was identified by practice leaders in the ASHP community. And there were pharmacists in a couple of the sections, one of the councils that said to the ASHP and ASHP Foundation leaders, we really need to look at how we practice, and we need to elevate the level of practice across this nation, because if we don't, we're going to be at risk. So the Practice Model Initiative is it's pretty vast in terms of what we hope to be able to accomplish. There's a devoted microsite that defines the initiative, which is really about optimizing the talents of our profession and doing that in a variety of ways, relying on technology, relying on the effective use of pharmacy technicians, developing the leadership skills of pharmacists, and looking at the credentialing and the ways of working more effectively in the healthcare team. So I think it's imperative that we as a profession come behind advancing practice, and this initiative provides a host of resources for individuals to figure out how to do that at their organizational level.
And I think there's a self-assessment available.
Indeed there is. There were recommendations that came from a summit. The summit in 2010, November of 2010, yielded a series of recommendations for how to effectively advance practice, and we developed, ASHP and the Foundation working collaboratively, developed a hospital self-assessment where you can look at your health system and your pharmacy practice, evaluate it, rate it, and determine where you need to improve. And the tool provides recommendations and references for how you might go about that, how you might prioritize your next steps.
When you were in practice, you spent a significant amount of time in pediatric hospitals, children's hospitals. What's unique about practicing there?
I feel so fortunate to have had my first opportunity as a practicing pharmacist and leader to be in the pediatric environment. It made me a better pharmacist. We had neonates there, less than 2 pounds, and you needed to know how drugs worked in the body in immature organ systems. And so right from the get-go, I believe that I became a better practicing clinical pharmacist. And then as a leader in the pediatric environment, nobody likes to see an ill child. And so the teamwork approach was, the team was receptive. And while when I got to Children's Hospital in 1978, pharmacists were in the basement, by the middle 80s we had a residency program, pharmacists were on teams, and so it was uplifting. So I'm not sure that you could say that pediatrics is totally unique, but clearly some of the factors that I mentioned make it an environment ripe for teamwork, collaboration, and the application of the talents and knowledge and skills of pharmacists.
When I began practice, a diagnosis for leukemia for a child was serious. That's not so today. We provide so much more therapeutics.
Yeah, and I think that the pediatric patient and the challenges, there's so little a bit of clinical studies and work that's done on the use of medications in that patient population. It's really one of the areas where the pharmacist's contributions are so needed and so valuable.
This has been great, Steve. We really appreciate your time. Thank you very much.
Thank you, Sarah.